speaker is Rubén Palomo. Welcome.
Thank you very much. And thank you all for being here listening to us, and Autism-Europe for the organization of this incredible Congress. I represent the Fundación Miradas Foundation. That is a foundation from Burgos, Spain, that one of its main objectives is to promote the quality of life of people with autism. So that's the reason why one of its focus is in early detection and early intervention, for obvious reasons that we all know and we all share, but it's good to remember them. The reason is because early interventions help very much the children with autism to improve. Many researchers have demonstrated that early intervention can help people with autism to learn crucial skills for the development, the social development, as share attention, initiate joint attention, play. They also have demonstrated that early intervention helps people to improve in their cognitive skills, their communication, their language. They also learn adaptive skills. And one important thing also is that they reduce the social and communicative symptoms from autism. They also have effects on families. They reduce its stress, it empowers them, they teach them many skills to relate with their child. Quite interesting effects. So that's why in our foundation, we have been, in the last years, focusing our work in early detection and early intervention. We developed it with Autismo Burgos and Burgos Hospital an interesting and innovative in Spain program to detect children with autism, children at risk because they have siblings or for other reasons, but also in regular population. So the program was developed to detect people with autism at risk and in the general population. When we found children that have important difficulties in the social communication area, we offered them intervention services for free. And that's what we are going to present here, the results of our modest contribution, our modest research in our program. That's what we want to present you, emphasizing that we are not a research center, we are not an university center. We can be seen as a regular and ordinary early intervention service specialized in autism, like the other ones that they are in the community, specialized in autism. So what have we done? We have created a program, an intervention program, following the Parent Early Start Denver model. From the commercial book, we generated our own program that is quite close to the program in the book. It addresses the same topics, more or less. You have them there: social orienting, social routines, and turns, joint activities, nonverbal communication, imitation, the regular skills and abilities that all programs have. We do it at home, of the families at home, and we teach them to promote these skills during natural play situations and in the social routines. We created a 20 sessions program that lasted around 1 hour and 15 minutes, more or less. We gave them 2 sessions a week for more or less 4 months. And we asked families to work with their child 20, 30 minutes every day. Again, we emphasize that we are, as the regular people in the intervention services, our professionals are really skilled professionals, very experienced, but we are not certified in any model. We work as people in the community do. The session in the programs were like you have there. We review the last days with the family to check if everything is fine and find solution. If not, it was not. We record parent-child interactions for future analysis and to see how they are progressing. Then we discuss the topic for that day that previously they have read, and also then the professional demonstrate the skill. Then the parent practices and they receive corrective feedback. And at the end, we discuss everything and we plan the work for the next session. That's the program, again, quite close to the PSDM, but we are not following it because we are not certified on the program. So what have we done with that program? We had the intervention, the 10 months intervention, and we evaluate the children like 1 month before starting and 1 month after the program ended. When they, in the time 1 evaluation, they were at mean 19 months, and in the post 6 months more older. In both times, we evaluate them with the Bailey scale of development, with the Vineland of a measure of adaptive skills, with the ADOS to evaluate their autism symptoms, and also with the SCQ. In the time to evaluation, we also check how many times they receive other interventions, that there were no difference at all in the children, because in Burgos they receive like 15 minutes from a public service, so they were all more or less the same. And also we analyze the satisfaction of the family. Today I'm going to present the data that we have by now of 9 participants, 5 with autism and 4 without autism. Here they are. We cannot go in deep, so just to say that 2 people have a sibling with autism, 2 people, this one and this one, were girls, and as you can see in the HD groups, just 2 people, just 2 children were older than 21 months. I also want to highlight that no one have cognitive delay, but most of them have important delays or deficits in language, and something I think important to understand our results, that the severity of all of them was quite high when we measured it with the ADOS calibrated severity algorithm. So the results, what have we found? We have found that children improved. In these 6 months, they improve. All children improve in their cognitive level, but significantly those with ASD. Those without ASD also improve in communication and language. People with autism didn't improve too much in adaptive skills, a little bit in communication, but people without ASD, they improve. And most important, what we found is that people with autism, children with autism, reduce significantly their symptoms, their ASD symptoms, their social symptoms, because they didn't reduce the repetitive behaviors. The same data in a different way. As you can see here, the decline of ASD symptoms in the ASD group was important. Here you have it subject by subject. And this is the no ASD groups, the other 2 collapsed. Here is interesting that 2 of them reduced their symptoms enormously, something that we didn't expect, honestly. And we are trying to understand why. Those were the oldest child in time 1 evaluation, and those were also the ones that in the time 2 evaluation must receive the model 1 instead of toddler's model. I don't know if that has something to do, but it could be. So as we have the opportunity to follow them, that wasn't planned at the beginning, we did, to check its development and to understand the data. And we have found that these 2 people didn't keep getting better, and this was a little bit worse, but the others keep reducing their symptoms. And another interesting thing that we found is that repetitive behaviors didn't went better. It was the opposite. They went worse. The family satisfaction, I'm done in 1 minute. Family satisfaction was huge with the child progress, with the program, especially with the professionals, and also with the changes they found in the child and in themselves. As a conclusion, we have clearly found that our program makes the children improve, but as we don't have a comparison group, we cannot clearly state that it was due to our program. We really believe it was, but in rigor, we cannot say that. That's what we are trying to improve our design and our data, following those children that rejected the intervention because they live very far away, and trying to organize a control group with children that came to us at the same time, at the same age as our sample had in time 1. So what we can say is that we have helped people to improve in their cognitive level, reduce their symptoms, and also we want to highlight the importance of parent-mediated intervention. We have to help people with autism, children with autism, to learn pivotal skills that help them to improve in their development, but we also need to create contexts that promote development, and that's one of the important reasons that we are involved in parent-mediated intervention. Why did we find such a good results? We have to still work on that to have a clear question, but one of our guesses is that we are putting in work the same principles that the global models developed in their models. So that's our guess. We have many limitations, but we are working to improve them. And I'm out of time, so that's all. Thanks. Thank you very much.
Thank you, Rubén. If someone has any question to the presenter?
Are there any questions?
No. Yeah, there is someone. Could you just approach a micro, which is somewhere here?
Yeah, hi, thanks for your presentation. I just had a question about the therapist demonstrating techniques to the parents, because in the ESDM model, or PSDM, they don't advise to demonstrate to the parents. So I just wanted to know how that worked out and whether you thought that had an effect on the actual intervention.
I was thinking your question.
Yeah.
I think we have been based on the PSDM model, especially, but we are kind of eclectic. So that way of working, it's quite close to other models, like impact model. And we think that the demonstrations help parents to understand what we are talking about and to focus on the important things, because when you demonstrate, you say what you are doing to help them to focus on what you're doing. So I think it's quite positive to demonstrate the skills.
Okay, great, thank you.
I don't know if I have answered you.
Yeah, no, it's a question that we asked, yeah. Thank you very much.
Thanks to you.